So think about the presenters that we've had so far. We've had our preeminent national agency on research and practice for the Centers for Disease Control and Prevention, our governing organization, Shape America, for physical education and health education. We've had a think tank organization, the Aspen Institute, and our local think tank here that we have in this room of how we're coming together on this topic. So this next panel is about what we're doing here in Delaware, and probably more importantly, what is the opportunity to do more? How do we enhance what we're already doing within physical education? How do we do more in our community around physical activity and the promotion of sport as a tool to bring youth together to learn lifelong behaviors? And what does that look like? So this next panel, as I invite the panelists up individually to sit up here, is to begin thinking about, we're doing good work, but how do we get to be doing the best work across this state, and what does that look like? So the panelists would talk. I'll ask 4 questions. They'll each have about 1 minute to 2 minutes to respond. At the end of those questions, it's your opportunity to ask them questions about how do we localize this work? How do we take all that we've heard nationally and begin applying it locally? How is that resourced through funding and people? How do we have a mandate that enables us to do that work and sustain it? So this panel is to start that conversation. But to have a conversation, we need dialogue. So don't leave them up here as a talking head. Ask questions. So that's your challenge at the end of the discussion with the panelists. So I'd like to invite them up. First individual I'd like to invite is Deborah Bagatta Bowles, who's the president and CEO of the YMCA of Delaware. Deborah? Our next discussant is Madeleine Bayard, who's the vice president at the Rodel Foundation of Delaware. Madeleine? Our next discussant is Deb Buenaga, who is the executive director at Preston's March for Energy. And our last discussant is Jennifer Robbins, who's the general academic pediatric fellow of Division of Weight Management at Nemours AI DuPont Hospital for Children. So as I mentioned, we have 4 questions. And the idea here is to present what the issue is, what the opportunity is, and what are our next steps. So we're going to leave you with a call to action. Each one will identify a charge for you to carry forward out of this room. So the first question I'm going to ask the panel, and we'll start from my closest to my furthest, and we'll start with Jennifer. First, we're going to have each of the panelists just introduce themselves, identify their name, their organization, and what they're currently doing to promote physical activity and health for youth throughout Delaware.
Okay, can you hear me? So my name is Jennifer Robbins. I'm a pediatrician at Nemours AI DuPont Hospital for Children. And I work mainly in the weight management clinic. So we're seeing hundreds of kids every month with overweight or obesity and evaluating them with their families. And we have a diverse team that sees the patients. So we have psychologists on the team, we have dietitians on the team, we have medical providers like myself, and then we also have exercise physiologists. For these kids, what we're usually doing in terms of exercise is utilizing our exercise physiologists. So they have a range of personal training. There are exercise classes that occur after school at our site in Wilmington. And they also do some personal assessments. We do have many patients that come from all over Delaware, and sometimes getting to classes at our site is hard. So we do often refer out to probably a lot of you guys for partnerships, YMCA programs, and other sorts of programs after school. But that's where we are right now in terms of physical activity.
Thank you. Deb?
My name is Deb Buenaga, and I'm the Executive Director of Preston's March for Energy. We provide adaptive bikes for children with special needs all over the country. We're based in Wilmington, but we service children all over the country. I also run with my son. I'm a marathoner, half marathoner, 5K, but I push my son who's 18 years old. Why? Because that's how he runs. I recently worked with Senator Poore to make every race in the state of Delaware inclusive. So now if you go to a race in Delaware, hopefully you see people crossing no matter what their ability is. Those of you that live in the Newark area and heard of Preston's Playground, Preston is my son, and I'm the co-founder of the playground. It's going to be a 100% accessible playground located at the reservoir. It's going to be about 8,400 square feet, and it will, again, be 100% accessible no matter what your ability is. Last but not least, as you know, I'm a huge, huge advocate of adaptive PE. And we're getting there. We're PE teachers. We're going to get there.
Thanks, Deb. Madeleine?
Hi, I'm Madeleine Bayard from the Rodel Foundation, and I'm also the co-chair of the State Early Childhood Council. At the Rodel Foundation, we work to convene partnerships and bring data and expertise to the conversation. So you may have heard of the Vision Coalition and Student Success 2025, which is the state's vision for public education. We support that effort. And then we help catalyze things that we think can have a big impact. So I worked on the plan to build the State Early Learning Challenge, which has provided mental health consultation, professional development, more screenings for early childhood, as well as start things like the readiness teams in 20 communities across the state.
Thank you. Deborah?
Hi, everybody. I'm Deborah Bowles with the YMCA. I would say if the YMCA has an overarching strategy in the state, it is that we want to create as many points of access as possible and to reduce the barriers to that access. So that can be anyone from a baby to a teenager. It can be a student athlete to someone in a wheelchair, and how do we make our activities and all of the things we do accessible to all of those groups. We serve now about 30,000 young people in the state in all kinds of ways, from the traditional things like swim lessons and sports and fitness centers, but we have about 50 partnerships with schools where we provide before and after school programming, and we implement a physical activity curriculum there. We teach second and third graders water safety, ostensibly water safety, but then it becomes swimming, and then it becomes physical activity, and anecdotally then it becomes confidence in the classroom. So we have all these kind of sneaky ways that we get physical activity into things outside of the formal venue. The great thing is we are a statewide Y, the only statewide Y in the country, so when something works, we can scale it. Healthy weight in your child is a good example. We just started it in a couple of our locations, and soon it will be everywhere. So we just look forward to doing more.
Thank you. So as you begin thinking about your questions, think of the representation that we have up here and the scope of the work that they provide to the state of Delaware. We have healthcare. We have an organization that supports a very important cause, but also outreach to a very vulnerable population. We have a philanthropic organization that serves the education field. And then we have a youth-serving organization that represents many of the nonprofits that serve our youth throughout the state. So as you begin thinking about the question, think about those sectors and what those sectors need to be doing together with others to advance this work. Which gets into the next question is, what do you see as the principal issue affecting youth physical activity? So what are you seeing organizationally in your work now, and how do we define that and move it forward?
Well, I can speak to what I see in clinic pretty much every day, which is kids coming in with their parents saying that they know that physical activity is an issue. They report that this is why they think that their child is overweight or obese, but they're not quite sure how to fix it. I see, we do questionnaires when patients come into clinic asking about how much physical activity do you get a day? And a lot of these kids are very, very sedentary. We see reports of screen time of 4 or plus hours a day. So if you think about that, that's pretty much from the time they get home to the time they're going to bed. There are, we recently had a study where we had kids wearing Fitbits during parts of the day, or throughout several weeks, and they're getting the most physical activity when they're at school. So it's those 8 to 3 o'clock Monday through Friday, not on the weekends, not when they're home. And when asked about other activities that they do, it's really few and far between, and it's very hard. So families come in and they have a lot of other barriers to getting to physical activities. So I don't want to overstep my time, but that's where we are. That's where we are right now.
So just so the panel's aware, we're doing fine on time. If you want to, and I don't have any need to encourage Deb to do that because she's just going to do it already. Because she's so well spoken on this issue and has a lot of passion about it. So Deb, what are you seeing as the principal issue?
So fortunately, I've been able to help kids that haven't been able to get out and exercise. I've been blessed to give them the opportunity to be able to get out and exercise. The simple act of riding a bike, something that we all take for granted on, I've been lucky enough to be able to adapt a bike just for them. These kids that never thought they'd get up, they're able to get up. A lot of their parents say, can we bring their bikes to school because they're not getting any activity at school? Of course, work their bike into the school. If you can get it to their school, work it into their school. Work it into their PE time. A lot of the teachers, even the PE teachers, ask me, how can we get them involved? And I go to the school with my son Preston and I teach them. I show them how to get involved. Unfortunately, it's the education. I'm trying to educate them as a one person, but they need to be educated just like we showed those parents how to get their kids on a bike, that they can ride that bike. We need to educate everybody needs to be able to exercise no matter what their ability is.
So a couple things. One is this plan and the work of our teacher council really is about making school more engaging. We know that kids are dropping out because they're bored. And so, the teacher as the sage on the stage is really no longer what's going to be engaging for kids. And we have so much technology and opportunity at our hands, we should be using it. We don't go so far as to say everyone should have an IEP because I think that, kind of threatens people with all the paperwork and compliance. But a personalized learning plan is really the future. We have so much data that education really hasn't kept up with, and technology to empower every kid to be able to personalize their learning based on their style, their choice. And that really should be physically engaging as well as cognitively engaging, and we know those two things are connected. So one is just making school and how we deliver education a more engaging activity, and figuring out ways that projects can be physically based as well. So I think integrating physical activity throughout the day and giving teachers those supports. I don't think every teacher knows the brain energizers that they should be using. And so it's not a matter of they don't necessarily think it's important, but they might not know how to do it. And the same goes for parents. I'm a parent of young children, and in the early childhood community, we've been promoting the QT 30, the quality time 30. So spending 30 minutes directly engaging with young children, because we know that's how their brains are built. And I think that's just as important, motivate the first date. I'm excited that we can promote that too, because on bad weather days and you have little kids and you want to know what you could do with them, I think enabling parents with strategies so they know what to do is also really important.
So I guess if I knew 25 or 30 years ago when I came into the Y what my job would be today versus what it was then, back then we had basketball, swimming, and sports for kids. Maybe if you were really enlightened YMCA, you had some dance classes. So now we have this incredible variety, right? And so you would think there's something for everyone, but our challenge is connecting our families and our kids with those services. Downstate, we see transportation is a big issue. Today, I would say stress and sometimes food uncertainty are some of the challenges that our children face, and that manifest in strange ways. So a child may be very overweight, but that's only because They eat a lot when food is available, and then they have periods when they don't have much food or they have poor quality food. So there's a whole learning there and educating the family. I think the challenges in our current political environment are making their way down into our children, especially our children of color, who feel nervous, they feel marginalized, they're worried. I have children in programs worrying about being deported, although their families have been here for years and are legal residents of our state. So these are things that you wouldn't expect to find in recreational work, but it's in school, and it comes into our before and after school programs and into our preschool programs. So again, it's how do we help these young people relax enough to be able to accept that they can try new things. And so when I think about WaterWise, which is a water safety program really geared toward low-income children who don't have access to pools and swim lessons, for those young people, the thing we hear the most is, this is just where I relax. And it's really a wonderful thing, because I don't think we really know yet fully what the impact of this stress on young people from such a young age is going to have.
Thank you. So this next question is really to challenge the panel. So they're going to respond to the question I asked, but I want you to think about, is this really the greatest opportunity that we have going forward? So they're going to respond to this question, but I want you to think about, is it really? And then you have an opportunity to ask that question and challenge some thinking around what you think the greatest opportunity is. So for our panel, what do you see as our greatest opportunity to promote youth physical activity? So identify one area that you see as the critical piece. Is it policy? Is it programmatic? Is it resources, such as funding or people? Or is it something radically different? Is it a new innovation that we have yet to hear that we should be doing? You get to lead off.
I think that's a very difficult question, but I still think that basically we're going to see the most change if we can get our schools involved in a lot of these changes. I think we have a lot of really great school nutrition programs that serve as a nutritional safety net for our kids, and I think we should think of school physical activity in the same way. I think we should have a fitness safety net for our kids in schools, and whether that comes from increased training, increased funding, increased mandates for what we expect in terms of physical activity and standards. I think that part of that needs to involve the schools. We see a lot of what we call sort of the staircase growth chart. So even during the structure of the school year, the weights will stay relatively the same. And then over the summer, when there's less structure, kids aren't in school, there's no activities, the weights shoot up, and this happens year after year, and that adds up into a lot of sedentary behaviors and weight. And I think that schools have done a good job in some regards with a lot of nutrition programs now extending over the summer, and I think physical activity has fallen behind in that regard.
Thank you, Deb.
Back to inclusion, which I'm a big proponent for. I have to say, in the state of Delaware, there's not 100% accessible playground for our kids. We have a couple that are 70% inclusive, and they have mulch. So how can my son with a wheelchair go on that? So in order for us to construct a playground that is 100% accessible, it's funding. We need money. We have the resources, we just need the money for it. Also, in the school districts, how are we going to teach our teachers? How are we going to bring adaptive PE into our schools? Right now, in my school district that my son's in, we have one adaptive PE teacher, one. And he goes around to all the schools. If we had the funding for more adaptive PE teachers, we had the funding to teach every one of our schools, the teachers in the state of Delaware, everyone would be educatable in PE.
So this plan that I mentioned really is to try to envision 10 years out sort of what education can look like. And I think the big opportunity is to this is what we call the student experience. So what will the student experience be? How can we create a student-centered learning opportunity, and how can we blur the lines between what happens at home and what happens in the community. I think our greatest opportunity is to build on things that we have, like the Y partnering with schools, like students going to First State Ballet or to the Y for swimming during the school day. It gives the teachers a chance to get trained or plan, and it takes advantage of community resources. I think we could be doing a lot more of that, and even giving kids credit for things that they want to do that are in the community, and leveraging our community assets better, and also bringing in families more. I think there are good examples of, Walking Wednesdays at my daughter's school where parents can come in, but I think we could do a lot more to leverage parents, especially like Deb, who want to get involved and want to do more, and can bring their expertise or their resources to the school. So I agree it's about schools, but schools need everybody to help, and I think that'll even expand the opportunity to have an impact.
Madeleine, just real quick, what website would they go to get that resource again?
This is the Vision Coalition, visioncoalitionde.org. I also have some flyers, some pocket maps, we call them, of this, and I'll put them out on the table afterwards.
So visioncoalitionde.org.
Right.
Great.
I would say more creativity in thinking about partnerships. There are so many different partnerships. Again, a year or even 2 years ago, I would never have thought we would be a part of. Waterwise, for example, partner with the schools, go in, make a presentation, say we'd love to teach your second and third graders to swim. Half of them say no, we go away dejected, but we get a few that say yes, and now we come back to the others and say, look what we did with red clay, we'd like to do it in your school district as well. When we got the call from a family that said, our whole family comes to the Y, but our daughter's in a wheelchair, she can't use the Y, we want to work with you to develop some kind of a solution. We had no idea what we were doing. We could never have done it alone. We worked with Enlighten, we worked with the Koch brothers who invented the harness system, we worked with the University of Delaware. So again, a partnership born out of need that now looks like a wonderful, innovative project that I just had a light bulb idea about, but it wasn't that at all. It was really just being open and having a little humility in understanding that we could not have done that alone. If anything I've learned in 30 years with the Y, there's always a way. So I'm not a big believer in there's no money, there's no money, there's no this, there's no that. We figure it out. And one of the ways that we figure it out is we partner. And we get help from each other, and we give help when we can.
Thank you. So our last question for the panel before you ask questions is a challenge to you. So the hope and opportunity for us here today is that we find at least one call to action. Now you can certainly grab many more, but each one of you leaving this door needs to grab onto something to leave with and to do tomorrow and beyond. So they're going to challenge you to think about what that might be. If you leave here just and thinking that was a great conference, that was a good opportunity, I got some nice information, but you need to catalyze it into something, into action. So the next question for the panel, for the audience, is what is one thing, one call to action you would like the audience to do tomorrow and beyond to support youth physical activity? So if you could just kind of articulate a vision for them to act upon, whether it's focused on what they do at home, in the community, at school, but give them some call to take home with them.
So I guess, to reiterate a lot of what the rest of the panelists have said, really my call to action would be to involve parents and involve whole families and be really, family-centered in whatever you do. So making sure that what you do leads to even good role modeling by parents. I think it's one thing to have a kid signed up for, sports for one season, but to really make sure that this is happening year after year after year, or making sure that this is a priority of, the whole family unit means taking that time to sit down with the family and really personalizing these experiences for the people that we see.
My mind just went, this is what happens when you get old. Rich knows. Okay.
Yeah.
So I think the one thing, I'm actually an an overachiever exerciser. So I think that if you take one, again, if you look at your family and you look at what your family can do together and to promote and to help your family, and not only help, one of the slides I think said, advocate for others. Yes, I advocate for my son, but I advocate for others. It's not just Preston. When Preston got on that bike 5 years ago, my husband and I looked at each other and we said, what are we going to do? Well, you know what our answer was? Pay it forward. So we've paid it forward, and we're helping other children get on that bike, get on that opportunity, have that opportunity to ride a bike. So you know what? I guess my one word of advice when you leave here is pay it forward.
So before we move on, Madeleine, just real quick, yeah, please. Just a little story about Deb. I met Deb about 5 years ago when she just started Preston's March. And the power of a vision in one person, if you think that you can't make change in anywhere else or in anyone else, Deb serves as an example that you can do that. She took the power of just a simple contribution to get Preston on a bike and moving, and took the passion from that and moved it, not just in her community, but across the state and now in many other states across the U.S., just through a simple idea of paying it forward. So Deb, thank you very much for that. Madeleine?
Well, I asked my 7-year-old, what should I say today? And she said, have more gym. But I think, all the ways that Irene and others shared, that Mary shared about incorporating, gym, but physical activity throughout the day, not just in one class. And thinking about ways to use it to make school more engaging. So we hear a lot now about, different really centers like we see in early childhood, but for older kids, whether it be computer time or group time or that kind of thing. And how can we bring physical activity into the projects that they're doing or into the centers that we're building in classrooms, rather than individual desks. And I think kind of grabbing on to what the current in vogue topics are. We're hearing a lot about social and emotional needs of children, and all the adverse childhood experiences and what we know about that does, what that does to the brain. I mean, we see the data for that, and we see the data for physical activity, and I think we need to make sure both of those are being brought forward to policymakers to show what an impact they can have on academics.
I would just encourage everybody to share. So whether you learned how to make a new green drink today or you learned to swim today, tell someone about it so that they can take part themselves. I think that sometimes we get a little insular and it gets worrisome when we don't have enough resources to do what we need to do. But I think the more we tell the story about the great work that we're doing and kind of pass it along and maybe get some feedback from the other side, I just think that these things have a way of growing in ways that we can't anticipate. And I think that this work is really too important. If we think about a generation of children now tracking to have high cholesterol, have type 2 diabetes in their 20s, it's horrifying. And we can pull that back. We can step away from that ledge with just tiny steps. So I would just say share whatever you have that you do, that you know about, that you've heard about, share it, partner, and I think that'll push us ahead a little bit in an environment sometimes where the money just isn't going to fall on our heads.
Thank you. So now it's your time, right? This is a very important time. We have about 15 minutes or so to ask critical questions of this panel. Jonathan, why did I know you were going to be standing up, buddy? So he's always the first one up there. Jonathan?
I expected that reaction too. There was a lack of enthusiasm that Jonathan was. So we need to say these things over and over again, and we need to stop patting ourselves on the back. We are marching steadily and consistently towards that future of staggeringly high type 2 diabetes rates, hypertension, and have been for some time. And this state is going lower in the rankings on childhood health indicators over the past 10 years. little by little, we're doing worse. The recommendations from the CDC and the Institute of Medicine have been well known for a long time, and we're not doing them. The wisdom of children. More gym class. We need to do what we know we need to do. And I hope that's what comes away from this event, and I hope that's what everyone in this audience takes away. We have to fix this, and we're not yet. But we can. We have to stop believing that we can't. We've come up with every reason why we can't do anything. We have to stop doing that and go, no, this is what we're going to do. I was very happy to see a lot on the transportation system. Some folks in the audience know that I'm the immediate past chair of the Governor's Pedestrian Advisory Council, and I've got to drop another very staggeringly unfortunate truth upon you. This is the deadliest state in America to be a pedestrian. It is, the carnage on our roads is obscene for pedestrians. So let's fix it. Let's fix this. Let's go down the street to Legislative Hall and say, we're done with excuses. This is a great state and a great community and a great neighborhood. And we need to do what we need to do to fix these problems.
Other questions? Dave?
I have a question. Preface it by, I think we have a knowledge versus action gap in the state of Delaware. Maybe not just the state, maybe other places as well. But we have known for some time, we've known physical activity is good, is healthy for children for their physical health. And then we found out physical activity is also good for students' comprehension. So it helps their academic life. And we know that physical activity is good for their emotional life. Physical activity is a good outlet, and kids that are more physically active have fewer emotional problems. And now we know that physical activity is influential in helping to prevent cancer. How much evidence does it take to help to get our policymakers to get their attention and give them the courage and the will to take action? If you think about, I'm a retired educator. Our physical educators in the room are great people, but in the schools, they are still redheaded stepchildren. They are.
Yeah.
And how many parents would charge the halls of school boards and legislatures to say, it's fine for my kid to get 1 day of English a week for an hour, or 1 day of math a week for an hour, or if I need to take something away, we'll take away that math or English. They'd go crazy. But yet we're only too willing, and have been for years, to trade away physical activity and physical education. The state of Delaware has gone for 3 years without an Ed Associate in the Department of Education for physical education. That's ludicrous. What can we do as policymakers or influencers of policymakers to change that?
Thanks, Dave. And Jonathan, thank you for your comment as well. You can certainly redeem yourself with a question later, though. All right? I'm going to give one more option. So I'm going to, Madeleine, this is a big ball of wax here, right? You willing to take on this question? What can we do?
Yeah. Well,
Right.
I was interested. I was talking to some teachers at my table at lunch who didn't say redheaded stepchild, but, said it in a different way. And, my reaction was, not to the kids. They're the biggest celebrity in the whole school to the kids. And so, we know that as parents. And when they ask us to come to Walking Wednesday or to the dance or whatever it is, a lot of us are there. And I have heard parents say that they're not going to go to public school because there's not enough recess. And so I think parent demand is ultimately what's going to change policy. Yes, data does, and data convinces parents and other policymakers, but we've got to have good models that show what's working and repeat those and repeat those and repeat those, and then have demand, have waiting lists for those schools, have us calling our school boards and calling legislators, saying this is unacceptable. The national recommendation is X minutes for this age group. So yes, I think it's up to policymakers, but I think it's up to all of us to share what's working and then to demand more of that. And to work with educators to figure out how to do it. It's not just PE, it's all the things during the day. The energizers, the transitions, the morning movement, all of that. And I think the more we can show models of where that's working and not sort of being mandated, the more people will take it up.
Deb, did you have a quick comment? No? Other questions? Yes, right here.
Well, first, I want, sorry, my gym voice. I want to say thank you for inviting the educators to come today, because we very much appreciate being a part of this. So in my district, I think that we have a wonderful district, but typically, let me give you a little background about what our kids do for physical education. I have 2 elementary kids of my own, and one of them gets 40 minutes after transition time a week. And he's 5, so he needs a lot of time. He needs way more than 40 minutes. So, and if it's nice out, then they get to have recess. When it's not nice out, they have classroom time for recess, which isn't, so they get to sit and play with toys. My other one gets 2 weeks every day, and then 2 months no phys ed. And then 2 weeks every day, and then 2 months no phys ed. So, and all of those things are meeting our Delaware requirements for phys ed. So on the Delaware education level, we need to change our requirements. It says that they need to be enrolled in PE, but what does that look like? Enrolled and our requirements are not the same thing. At the high school level, these kids in our high school only need to take what totals to be a half a year of phys ed for their entire 4 years in high school. So I think that we're doing the students a disservice by not changing that requirement and regulation. We could be doing more very easily, and we would love to do more, but we're giving those students, if they're going to get pulled out of a class, they're going to get pulled out of phys ed. If they need to have a meeting, that's the time it's going to happen. If they have to go and serve a consequence for something, people are taking them from there. If they need pull-out for reading or for math, it's going to come from PE. And we all see all the benefits. So, knowing all those things that it's impacting, what are we going to do to get the funding we need? One, because it's going to cost teachers, and we know that we're in a funding crisis. So what are we going to do to get the funding we need to have the teachers to be able to teach extra classes? And then secondly, what are we going to do to change the emphasis on not just reading and math and add physical activity back in?
Wonderful question.
I have a couple ideas.
Who wants to lift one on that?
I answered the last one, so.
Madeleine, you want to start that one off, and maybe others can chime in?
In terms of the where you're starting with the regulations, so what are the rules? That's really the state board's purview. And it has been effective. I've seen over the years examples of schools presenting what's working in Delaware to the state board as compelling evidence of why something should change with national best practice. So that's very compelling to show where is Delaware, where are we not meeting what's nationally recommended, and what's already working in Delaware that we could be scaling up. So I would challenge this group community to think about how we could do that, and also apply for things like Superstars in Education with the business community. Ways we can get out the message to different audiences, but the state board with the regulations is the first place that something has to change. And in terms of funding, back to the comments that Deborah and I were making about creative partnerships, it doesn't necessarily just need to be more units. Yes, we'd love more units and teachers, but are there creative ways to have kids go to the Y for swimming, or have First State Ballet come in, or do other things that might be engaging, not just sort of traditional PE, and kind of think outside the box of typical one teacher, 30 kids, as we have in education.
Deb, did you want to respond to anything?
Or, we saw that video, we all watched that video of the school in Dover, that school didn't have the resources, didn't have the state resources, but that principal took the initiative, and she's the one, it looked like she's the one who started it all. Why not maybe use her as a, get her on the committee, get her on some type of committee, and spread it with all the other schools.
She's certainly a driver and a catalyst. And you want to respond back?
Yeah, I do want to say that when an admin has a choice between a unit that's going to go for... Now I got to quiet down.
You're back on the mic.
It's going to go for reading or math and improve their test scores, or a unit that's going to go towards phys ed, that unit is never going to go towards phys ed. It's never going to go. And we would love, we have been pushing and pushing and pushing. We would love to have an elective class in our school. We would love to be able to, teach some fitness ideas to classes and bring some other things, because we only get to have it. It literally becomes 2 months out of their whole high school for one part of their PE. So we get to see them total for 4 months of their entire high school career. We'd love to have an elective where we could teach them some life skills that they can take and bring that lifetime fitness to them, but we'll never get it because that unit has to go to the test. It has to go to math.
If you change the regulations, though, about what time kids are supposed to have, like you were talking about, that would be one way. And another way would be to use the data to compel leaders that not just more reading and math and sitting in a desk is what's going to do it. So, I think that's our challenge. Irene, you were going to weigh in.
And Irene.
All right, here's a challenge. And I've done this with the principals, because the principal is key. Principal is key. They are the ones you need to talk to. You give a group of teachers something to read. I like to give them Rikki Tikki Tavi just because I like to say it. And the page is numbered. You can put numbers in on Microsoft Word. You have them read for 2 minutes. Have them walk for 2 minutes. And then read. They will increase their reading up to 7 lines on that Rikki Tikki Tavi. This is what made the teachers change their mind, and I could sit back, and they're the ones that told the principals. We had a group of students, a principal said, I want to see this, where they had physical activity every day before they had math. The math scores increased tremendously. So it sold the principal. And once you sell the principal, they will make every effort. He hired recess supervisors so that there were people outside. He hired more paraprofessionals so every child was involved. He hired an extra phys ed teacher with adapted PE background. The data needs to be shared, but if our classroom teachers, who are like Einstein with their hair falling out of their head based on state tests, if they have the evidence that they're not just talking to themselves when they're trying to teach reading, writing, and comprehension and social studies and everything else they're required to do, but when they see evidence that their children have greater focus, they're more attentive, and they're grasping information after bouts of exercise, they're your best advocates. The kids all of a sudden go home and say, I know what I read today. Can you believe it? The parents are happy. The parents will then help promote. So really it is your classroom teachers in the school, they have really no idea what you do, because to them you're doing gym. And if they liked it, they would be phys ed teachers. And gym to them was on the end line, start running, sweating, who wants to take a shower before you go to class? I can't take a shower in 5 minutes. So you really need to target the classroom teachers in your school, and I think they are great advocates. And then your PTA. And you do that activity with them, and they won't believe how much further an adult can read, let alone a 6-year-old. So try it. It really works. Just a little evidence.
Thanks, Irene. Irene, I want to know what you're drinking today, because I want some of that coffee. So, but we do have our Woodbridge colleagues over there is a particular call to action that's coming out of that. So, Irene, I hear you loud and clear. All the earlier adopters are probably going to get that. So there's probably 20%, 25% of our schools that have the capacity to respond to your call. What I hear the folks from Woodbridge saying, look, we need a consolidated, and what Jonathan's saying, we need a concentrated effort to institutionalize this as a norm in our schools in some manner. And what does that look like? And we need help doing that, because you have a group over here that's very passionate about their job, and throughout this room that wants to work together. We need a convening voice to do that, to work in partnership, to help guide them, to give them the resources they need to leverage the opportunity that was spoken. Is that what I'm hearing? Yes. Okay. Who else? And I want to get one more question to Deborah, because Deborah has to get out of here at 3 o'clock, which is like in 30 seconds. Is that right?
Yep.
We have a question for Deborah?
It's on. So I did hear you mention, you're from the Y as the director. I heard you mention that you did have before and after school programs that were supporting the schools. Can you identify 2 other examples of how the Y works in partnership with the schools?
Certainly the before and after school. We have a partnership with the community education building in the city of Wilmington for the charter schools in that building that don't have a gymnasium, so they use our Walnut Street facility for that activity. That would be another way. We partner with the schools with regard to some of our signature programs like Black Achievers, Youth in Government, Leaders Clubs. Some of those clubs run in or through the schools with school advisors. Trying to think what else. WaterWise is another big one, the Learn to Swim program. And we also do some work with schools in terms of understanding what we need to do to make sure our preschool students are kindergarten ready. One thing I want to mention is we have some preliminary data from the WaterWise program. We did this in partnership with the National Swimming Organization to really look at how the students were doing in school when they were swimming during the day. So there's some data there that's kind of giving us some good indicators to share with principals and teachers.
Great, thank you. Before we go to the next question, Deborah, do you need to leave now?
I do need to leave.
Yes.
I'm sorry. I have a board meeting.
We're going to keep the other 3 panelists here. Let's give Deborah a round of applause for participating. So I am stretching the time a little bit as well. Deborah, thank you so much for participating today. So I would like to get at least one question for Jennifer and one question for Deb. Give Madeleine a little break here. Do we have any questions for Jennifer? Okay.
Jennifer, I do agree with everybody that we're missing the mark as far as physical activity goes, but in your clinical observations, what role is nutrition and overall caloric intake playing in the obesity rates that you're seeing?
Certainly, nutrition is a huge factor playing a role. I mean, we're seeing a mix of things. We are one of the largest adolescent bariatric programs in the country as well, so we see some extreme cases of misknowledge about nutrition and also a lot of environmental factors that are at play. And we see that also with physical activity. And unfortunately, I think a lot of these things sort of compound each other. So maybe the same, kids who aren't doing as well in sports early on, maybe because of excess weight, are leading to other poor health behaviors. So a lot of these things tend to snowball, and by the time we see them, a lot of times it's not too late, but it starts to get to feel that way. Prevention is definitely the key in all of this.
Thank you, Jennifer. Questions for Deb? Right here.
So Deb, can you expand a little bit about how we can implement and improve adaptive physical education?
Physical education?
Implement our adaptive physical education programs.
Well, I don't know. I mean, I do know a lot about the programs in each school district, just talking to some of the teachers, talking to some of my friends, and what they have and what they don't have in their school districts. I think the main thing is to first find out what's in your school district. I mean, in my school district, it's one adaptive PE teacher, and he travels around to schools, which is unacceptable because my son may get it once for the year. And then we need to go to our legislators, and we need to say, we need to teach all of these these PE teachers, these typical PE teachers, on how to adapt the curriculum to involve every child. How are you going to include a child, like Irene said, with a child with a wheelchair, attach a hockey stick to their wheelchair? But unfortunately, our PE teachers have very limited resources. They were only taught maybe a class in college about adaptive PE. We need to have somebody who can educate them on and then follow up with them. So if a teacher has a child that comes in with spina bifida and doesn't have use of their legs, but wants to play, wants to be included, they have somebody they can call, or they have a link that they can look on to find out how can I adapt. But the PE teacher needs to be that one to be able to make that first call.
Great. Any final compelling questions that we want to get to on the panelists? One more? Okay, our last question.
I was just curious, we heard just a little bit from you, Dr. Robbins, about with the weight management, what you were doing. How can or should, or what role should the healthcare providers be playing, or should they have in this whole effort to increase physical activity and to promote physical activity?
It's a good question, and I think a lot of what we can do is refer to our outside partners. So I think as much as possible, at least our clinic has tried to make some friends in the community and figure out what's available for our patients in different locations. And I think that, it's difficult, but taking the time to really figure out what opportunities exist for the kids at different ages, at different levels, is important. And I think if we can streamline that a little bit better, then we'll see better results for all the kids of Delaware.
Thank you. So before we get the panel applause and recognizing their time that they've contributed here and the thoughts that they've left us with, I know as we break, some of you have to go because you have other commitments at the end of this day, but we've heard some significant remarks around the opportunities and the challenges, but also these calls to action, right? So this next part's very important, the next few seconds that I'm going to share with you. When we think about what our responsibility is, and we think about our relationship to others and acting upon that, we're the only creature on this planet that has been given this beautiful gift. Of all the creatures that have been created on this planet, we're the only one that has this gift. And what is that gift? It's a gift of leaving a legacy. It's a gift of going forward and imparting onto others something that's going to change them and change this place, or change others in a very significant way that benefits, far-reaching into the future. Often we come to these locations and these opportunities either to get out of work or just to sit through it. It might be a good meal, it might be to meet new friends or to meet old ones. But when you leave these doors today, don't let what you've heard here today sit here. You've been challenged by 4 people to do something. I hear the call from the educator saying, we need help, where is it? I hear the call from the American Heart Association saying, look, we need to go forward and make a charge at Lake Hall. Where are you? I hear our researchers in the medical field talking about this issue and what we need to do. And all of this is to set up for our next speaker, Dr. Rattay, because she's going to leave you with some ideas and notions about what you can do and what you should do leaving this room. So never neglect and forget that you are the only creature on this planet that has the ability and even the care and curiosity to think about what you can do to benefit others. Yeah, 5-minute break. Let's give our panel a round of